outside the hospital, and we did like now approximately 8 sessions for medical surgical ICU and also for the nephrology department in Lebanon. So it should be today we complete and cover all the stuff in all the departments. Because you are an expert on the CRT PRISMAX, correct? We'll start with the differences between the PRISMAX and the PRISMAX. By the way, both machines are from the same manufacturer, from Pakistan, and before old days called Gambro. Gambro, Pakistan, same. It's the same designer, with the same factory. So now we have this PRISMAX. Actually, PRISMAX worked with us for more than 20 years. With different software versions and the same clean monitor, right? For PRISMAX, we'll continue this work. It means we are not making anything from scratch. We will get the benefits of PRISMAFlex and we will add some new advanced features on the PRISMAX. I will give you what is the added features on the PRISMAX. So let's start with the warming system. What you have now, you have the blood warmer, it's called auto control, with auto line, green line, which is can warm with a return line from outside, external heating. Now we changed this one to be Thermax or Thermax warmer. This Thermax warmer, you will not find any auto line or need to insert the line on this auto line. What we need to do is to use one accessory called Thermax bag. This small bag, it will be inserted inside like a CD. You remember the CD? You will insert it inside. And will be connected post filter and before return. We will disconnect this. We'll disconnect this post filter, which is coming like this. We will disconnect it and we will connect 2 ports to the Thermax bag. Don't worry, you will not confuse or switch because 2 different connectors. It means no confusion. Each one in the right position. So, what is the benefit? Why is it this new warmer? If you remember the current warmers that you are using, you are putting set point, it's like 41 degrees. And they deliver to the patient maybe 37, 36.5 like this, right? It means there is little or some gap or deviation between the set point and the deliver to the patient, right? The new Thermax one, it's an accurate one. It means very fast response. When you are putting 37, you will deliver 37. 38, 38. For that reason, the range of this one is a small range, from 35 to 38 only. From 35 to 38. It's called the clinical parameter. Previously or currently, you are using something called technical parameters. You are putting it from 33 to 43. This is your 10 degrees range. If you can minimize or decrease the temperature till minimum 33, maximum 43. But what is the actual delivered temperature to the patient? It's like 37, 37.5, 36, 36. Here we have this clinical parameters. It means you have from 35 to 38. If you put 38.5, will not accept. If you put 34.5, will not accept. From 35 to 38. Okay, got it? And very, very, very fast, very accurate. So, but we have to use this Thermax. What is the volume, blood volume of this Thermax bag? This one will be filled with saline during priming, will be filled with blood during session, right? Same like the blood lines. This one, 27 ml, 27 ml only. What about the filter side blood volume? M100 filter, approximately, when you are returning the blood. How much? 152 ml. Plus 27, 179 ml. This is the total extracorporeal volume you have. It means if you are returning the blood and you need to return all the blood, you have to return how much? 179. If you forgot what you will do, the machine mentioned 179 on the screen. But don't worry, it means the machine will give you, this is the amount that you need to return back. Okay? This is the first difference. What is the second difference? The screen itself, right? You have this foldable screen. When you are moving the machine between the rooms, you can fold the screen and also you can fold the blood worm. Now it become more compact, you can move it. If you keep it open, maybe it will hit the door and you find many of the scratches But remember how to make it like this. There is a knot or a screw. Lift it up and support it like this. You get another click sound. How to make it up? Pull it again. Easy. This is during transportation. Okay. So for the screen here, it's a big screen, more than 15-inch, colorful one, nice. It's easy to deal with it, more easier. I will explain on the screen later on when we are doing the hands-on. What about the power? Where is the switch on/off? In the front now. We don't have anything on the sides. Okay, no switch off on the sides. Only here, the green one. What about the red one? This red one for technical team, for service engineers, to make calibration, etc. But for you, only the green on/off. So anytime you need to run the machine and you're on the front, just do long the press here, keep it for 2 seconds, it will switch on and load the software. Easy? Please ask me if anything is not clear. Okay, what else? Other difference also. So you will not find here this barcode reader glass, the scanner, not here. Where is it? It's on the back here. Handheld scanner. Okay? This one. Why is they removed it from here and make it here? Because now this, it's not a single function now. It's multifunction. It means this patient has a wrist barcode, right? Okay, if I need to go to the patient ID, just scan this one from the patient hand or this your sheet, just to scan it. Easy. In less than 1 second to take the information. Second one, to scan or to detect the set attached, we scan it. Third one, we have extra option here in the left side called auto-effluent. Auto-effluent kit. What is auto-effluent? From the name, what coming in your mind? Auto-effluent. Yeah, auto-effluent, auto-drainage. What you are doing every 2 hours? Bag changing, effluent bag changing, right? What if you have extra option telling you that maybe for 1 week you will not change the bag, the effluent bag? Okay? It means this auto-effluent kit will be attached here with long line like 7 meter, can be hanged on the drainage pipe, and it can continuously work for 1 week with the same patient. So I can think, okay, but after 1 day filter clotted, what I will do? Okay, no problem. Replace the filter, use the same auto-effluent. Same patient, working for 6 days continuously with different sets, no problem. Okay? This is the advantage. But you need to have from the facility department, you need to have this drainage pipe to hang this auto-effluent. I can show you now this, the auto-effluent kit. It's like this kit. This one, like, it will be loaded on the left side, and you have here long line. This is approximately 7 meter length. It means if the machine is here and the drainage pipe is the last end of the room, you can do it. And this one will be hanging on the drainage pipe or the water sink according to your protocol and policy. Okay. Currently, it's not ordered by the hospital, but this is optional. It can be ordered anytime and you can use it, especially for the positive cases, for the very infectious patient, that you don't want to expose too much with those patients. You don't want to go every hour or every 2 hours to change the bag. No, you need to go every 5 hours, 6 hours, like one time, right? For those patients, it will be amazing and perfect to use this auto-effluent. Clear? Any question? But what about the normal effluent bag? We can use it? Yes, it's available. So this is another difference from the PRISMAX. What is another one? You see this is like one LED indicator here. 1, 2, 3, 4. 4 LED indicator. This one is light indicator. It means if it's the time to change the effluent bag, what this LED will do? Flashing yellow. The dialyzed bag empty, flashing green. Replacement bag empty, flashing purple. Pre-blood pump or replacement, flashing white. It means the machine will give you nice color flash light to remind you to change this or that. Easy? It's a new option now. So, can you see any difference in this part? Blood leak detector. Is it same, different? It's like positioning, right? The current one is vertical. This one is tilt on the left side by 45 degrees. Okay? This is the same design or same sensor, but with this 45 degree. Why? To protect this sensor from the light exposure, which can affect on the reading. It's more secure now, more accurate. And also the line will be more free. Before it's maybe kinked, but now it's more convenient to put it. Easy? Okay, let's go to another function. Maybe it's not finalized yet or registered, but it's available on the machine. A new therapy called E-core or CO2 removal. You have a patient with ARDS or acute lung respiratory failure. Those patients, if you have mild to moderate, maybe you can use another filter called E-core filter. This one before ventilation, maybe you can use it for 3 days, up to 3 days for each filter. It's called the E-core. This one enabled on the PRISMAX, not enabled in the PRISMAX. This is a new feature, E-core for ARDS patient, for patient who need CO2 removal. For the doctors that they are dealing with those patients, it will be very useful function. Okay, so other things are same. This is leakage detector, same like the PRISMAX. Sensor, if fluid coming down, the machine will detect there is a fluid leakage detector. All the pressure pods, same. One pressure pod here, removed. Because actually you didn't use it with the insertion, right? But they removed it, only keep the three, the main three pressure pods. Here, syringe 50cc, same 50cc syringe. And here, just lock, it's also easy to just look and unlock the wheels, big wheels to easy move. Same crank in the back, this is a manual crank, still attached on the back of the machine. Easy? So let's go to start one simulation treatment, two hands on, and to see how to deal with the screen. Here in the screen, you will find new patient. You will press on this new patient. The machine will test the syringe pump. Test the higher position, lower position, and adjust it, just to assure that this syringe pump is working properly. This is the proper testing process of the machine. In this time, what you have here the history, which we will see it during the session. The tools, also we'll see what is in the tools, same like system tools in the PRISMAX will be same icons or same functions. I will tell you, I will open it after some time. System, you will can adjust from the system the brightness and the sound level. Okay, the brightness and sound level, it can be from the system. Lock screen, this lock screen is a new option now. In PRISMAX you don't have lock screen, right? Here you can just simply press on this lock. Okay, now no response from the screen, and sometimes you are facing this problem with the relatives of the patient, family. Maybe they are curious what's this treatment, and sometimes they are playing. Or I don't know if anybody did this manipulation of this issue before, that touching the things. For now, if there is a visitor time, you can lock the screen. They will lock on the screen, but they cannot change anything. Nice option, good. How to unlock it? Unlock it by press anywhere on the screen for 4 seconds. Like press here, for example. 1, 2, 3, 4, like this. Okay? It will be enabled again. So, once we press new patient, the machine will adjust the syringe pump and will give you this nice screen, nice display. What we have here? We have here 1, 2, 3, you'll find 8 steps. 8 steps from number 1 patient till number 8 connect patient. You will fill it one by one, page by page. It means like 8 pages until to connect the patient. Okay? For page number 1, what is this one? Patient information. Remember, you have to put patient ID, you have to put the body weight and hematocrit. Same 3 pieces of information you have to put in the patient information. So we have here patient ID. You can write it or you can scan it. Okay, so I don't know if you have any thing with barcode. Do we have any barcode we can use? For example, I will use the, if you have, okay, glass of water. Okay, there is any barcode here? Okay, we can assume that this is a patient ID. Easy? This is number one. And you have to accept. So, secondary ID, it's not required. Sometimes not required. Weight, body weight, put anything. 70 kg, 70 kg and accept. What is the hematocrit? 30 or 28 or 29, whatever, and accept. It means you put the patient ID, body weight, and hematocrit. All good. What we have to do? Accept. Now go to number 2. 2 is the therapy. You have to choose what's the therapy. You need to do CRRT or to do TPE. And when this CO2 removal filter become enabled, now we will find a third option here. It will be E-core. It means CRRT, TPE, and E-core. Okay? You can use this chair. CRRT for today. Okay, and next. Okay, in CRRT, which modality? HDF, right? The full option one, the last one to select. And next, which filter? You are using M100, Osiris, whatever, you can choose. Okay, this is M100, I will choose M100. Okay, all in the therapy. CRRT, you will choose the modality, you will choose the filter. Next, which anticoagulation? Non or systemic anticoagulation? If you are using this heparin syringe, you can use systemic heparin. If no, you are using non. The good option here, the good thing on the PRISMAX is that maybe you can start with no anticoagulation and you can add it as a syringe in between. This option not available on the PRISMAX, right? If you start without heparin, you cannot add it. But here, we'll start with none and we'll add it later, okay? So next. Blood warmer, none or Thermax? We'll use it, right? You put Thermax. If you don't want to use a blood warmer, you will make it none. But now Thermax. And next. Last one on the therapy is, you need to use the autofluent or none. We will not use it today, we will use the classic one. It means non-autofluent, right? All next done. We have to go to accept. Once you accept, therapy done, checked. Means patient done, therapy done, and now prescription. The prescription is very nice now. It means you will press on the icon, scroll it, and to put the number. So we have pre-blood pump, blood flow, patient fluid removal, dialysate, replacement. I need to put first the blood flow. Okay, what is the blood flow? 150? Okay, for example, scroll it, 150. Nice? Go to the pre-blood pump, replacement pre. You need to put it 500, for example. Yeah. Scroll it to be 500. Okay. Like, I need to go down. Okay, I need to make my minus. You can do 500. What about patient fluid removal? Data will be put. Keep it 0. Dialysate, for example, 1000. Okay. Replacement, whatever. 600, 500, 460, 450, for example. So, and post or pre, you can put as a post or pre here. So we finish all, we'll confirm all. Easy? It's direct prescription. Okay, what if you wanted to change it later before connect the patient? You can also. Once you reach to review, you can re-edit the flow setting for the prescription. Easy? So, confirm all. Now, blood temperature. What's the set temperature you need to put? As I told you, what is the minimum? 35. What is the maximum? 38. This is a new blood warmer from 35 to 38. It's called the clinical parameter. So we put it, for example, 37, okay? Okay. Now we went to number 4. What is number 4? Sets. You have to scan the set. Okay. I attach the circuit now and I will scan it. There is a barcode here, right? So I scan it and now to attach it. Already I attached. To next. Okay, now you need to put all the transducers, right? Pressures, line. Okay, you see this circle? Yeah, amazing. What's this one? You can magnify it. The machine will, okay, this one. We can start from the top to the bottom. Okay, so what I can do, I will put same idea and keep it not kinked, not short, not long. You can see I put 3 transducers now, right? Check, check, check. Okay, I will continue. So I will put it now the return pressure, tight it properly. I will put the venous chamber. I will put the air detector. Okay. How many remaining now? 2 below pressure pots. Okay. So I will put this is pressure pot. Second one. Okay. All good? Yes. All checked. Easy. So like some tips here for this return line, we will push and tight the cap anti-clockwise. Don't twist this line. Push direct and tight the cap anti-clockwise. What about this deaeration chamber? This is new. Before you have only the black holder, plastic holder. But now you have this holder with sensor. This called level detector sensor. Will measure the blood level or the saline level and can adjust it automatically during the session. It's a nice option, all right? So you will clamp it, put it, all good. If not good, you will not find this load set active. You have to connect all the sensors. Any question? So load set, before load set, just this one it was like this normal. I didn't remove it now. And the other lines, sorry because it's used the same, but you will not do the same. You will not touch the floor, but just for training on. Okay, press load. Okay, just press next. Here. Okay, what is the time now? A time to insert. This is the Sterimax bag. Okay, so you know the direction here? There is one right curve. You can see it? This is the right curve. Don't make it in the opposite side. It should be in the same direction. Okay, otherwise it will not give you to confirm. It will be stuck. You have to put it with the same direction like the picture. So we will insert. Before insert, there is unlock and lock. This one, lock and unlock. It should be unlocked or open before insert this Sterimax bag. Okay, we will insert it. We see. Okay. So this one, it's used one for that reason. Make like bend it a little bit, but we'll try to make it like CD. Okay. C. Once inserted till the end, giving you this picture. What you have to do now, close the bag lock. Where is the bag lock? We'll give you here. Check. Easy? Okay. Next, you have to connect these 2 lines by here. Be careful, your hands, the position should be sterile position because you are now disconnect this, it will be the blood stream. The blood will come here after. But it should be very clean and quickly to tighten it. 1 and 2. You cannot swap it, you cannot switch it. It's one direction. Okay? So you connected now the Sterimax bag. Easy? Any question? So we'll check. We check that. Okay, you connected by proper way. 1, 2, accept. Now we went to number 5. What is number 5? Is the fluids. What fluids we have? Saline bags, CRRT bags, correct? We will start. Okay, so now is the time to hang sterile priming bag, which is the saline. We will connect it now do same technique, same way for the prism effect. We will insert the spark here to the saline bag 1 liter. Okay, like this. So just to check. Now you have to clamp the syringe line. Why? Why you have to clamp it? It should be clamped because we choose non-anticoagulation, right? That should be clamped. Remember, this is number 2. Check. Okay, it means saline bag attached, syringe line clamped. Okay, what's remaining now? Okay, open the scale. You see? Okay, so I will open it, and as usual, put the effluent back and connect it with the return line as normal. Okay, so we will connect the effluent back and we connect it with the return line. The return line should be wrapped by this paper tape. Keep it as it is, keep it tight, don't cut the paper tape now. We will cut it only when we are connecting it to the patient. So keep it wrapped as it is. And keep it open. This is the return line. Okay, so next is the white, right? So where we can put the white bag? You will take this carrying bar, put it here on the left side. Okay? And you will bring the bag, mix it, and bring it here. Attach it from the middle first, the middle hole first. Okay? After that, from the right, from the left. Before removing, connect it with which line? The white line, right? Free blood pump line with white clamp. So we'll push and tight. After that, take this back here to the and connect this one. What next? Same idea. Take it here. Second back. Next, middle, right and left. Which line? Green line, thank you. With a green clamp. And connect it here, push, and tight. Okay. And we'll go to the last one. So this one should be. So we need to keep this line in the front. So next one or last bag will be the replacement. We'll do it by the same way. Here, and this bag, we mix it and we'll put it here. It will be maybe right and left. Which color? The purple color, right? The one with purple clamp. So push and tight. And so no need you to sit down and to put the things. It's more convenient now, right? More easier. And this. So all done. 1, 2, 3, 4, 6. 6 checks. Okay, accept. Okay, we'll go to number 6, which is the prime. And no confusion in the prime. No other buttons. Only one button called the prime. That's it. No prime and prime plus test. One prime, that's it. How long? 10 minutes. 10 minutes, fixed prime time. We'll press on that one. Before press, assure that all connections are secured, are connected, all good. Just to prime. Here. 10 minutes, 45 seconds exactly. So, the machine will do it automatically, and from your side you can prepare your patient, flush the catheter, check the prescription, again review it. And after prime, we'll have to review the prescription and to connect the patient. Okay? So, now let's discuss together, okay, during priming, what you have to do? Maybe after 2-3 minutes, the blood pump will running faster. We'll do small tapping on the filter to spill or to remove the excess fluid or air or bubbles from the cell. What else? Any of the prescription can be adjusted in the review. Once you go to review, you'll find settings or this flow settings. You can go to it and change the blood flow and change any of the dialysate replacement flow rates. So let's discuss about the best practice during the session. How to start the session, your session, how to start it, with which blood flow? Usually we need to start as a smooth and gentle start. What is the blood flow you will start with? 100? Yeah, 100. So the doctor prescription between 150 to 250 according to the stability of the patient, right? Or toleration. But anytime you need to start with any patient, start with blood flow 100. And this 100 will be kept for 5 minutes. After 5 minutes, increase it to 150 and check the variability after 150. But minimum 100 in start. After 5 minutes, you should increase it to 150. Why? What is the reason? Because the first 5 minutes, the machine will take the blood from the patient slowly and back it to the patient to return. And now we will have a closed circuit. Once you have a closed circuit, increase the blood flow because no bleeding from the patient, no blood taken from the patient. It will be closed circuit. But to start gently, start small. And please don't forget this 100 for 1 hour, for half hour. Also, we are doing a bad thing. Why? Because clotting will be very fast. It means 5 minutes, start with 100. After 5 minutes, you have to increase to 150. You will tell me, okay, this patient's hypertension. Once you have this closed loop, after 5 minutes, you are not caused the hypertension, not from the circuit. Maybe other reason, not from this blood closed circuit. Maybe you need to increase the norepinephrine dose or the vasopressors. Maybe you need to adjust some medication, antibiotics, whatever, but not from the blood taken from the patient. Got it? Because it's a wrong perception or wrong idea that, okay, I need to decrease the blood flow to 100 to avoid hypertension. You will not avoid hypertension. If you are hypotensive, will be hypotensive with 150, will be hypotensive with 100. Any comment in this point? Increasing from 100 to 150 will not cause the hypotension. But the condition is start the first 5 minutes with 100. Okay? Usually when we are starting the CRRT, this is high flux filter, high flux dialyzer. It means by default, the doctor should to review his medication profile for the patient. Any medication is dialyzable, doctor should to increase the dose of it. This is by default, and I think you have protocol from doctor. Now without CRRT, you have this amount of antibiotics, this amount of norepinephrine. Once you start the CRRT, doctor should to adjust it, correct? Right? This is by default. Why? Because you are using high flux dialyzer. Even with 100 ml per minute blood flow, 150, 200, whatever. You are using dialyzer or dialysis, it means you can consider some of the medication will be drained by the effluent, right? So this is the best practice to do it in the beginning and after you start. This will avoid many of the clotting problems and will keep your treatment more easy, more smooth. Another thing, please don't start with a bad access. Okay, I think we forgot one line clamp. Maybe. Now we give us as a high filter pressure. Where is the filter pressure? This one. Why the filter pressure is high? So I'm thinking maybe from the axis here. set will be this ground. Here in the fluent bag. Okay, please ask if you have any question till now. Any objection, any question, any query. Easy, you can do it from start till now, easy. So let's review our practice for prime and reprime. Once we finish the prime now, the machine will give us a button called more options. In this more option, you will find two options inside: reprime and flush. Reprime and the flush. Okay, reprime will be 10 minutes, complete 10 minutes, another 10 minutes. You have to go to 1 liter saline bag, press reprime, the machine will do this again. We don't have prime and prime test, we have complete prime, no prime test mode, okay? So syringe is not connected to the set. It's connected. Continue. Let's yes. So I will replace this one once finished. I will replace it because it's kept the clamp for long. I have another one. Yeah. No problem. Just keep it. I will change it later. Again for prime and reprime. Here we don't have prime test. It means the prime test is a part of the prime in the PRISMAX. Okay. We will do the first prime, completed, and after that we will change the saline bag by another 1 liter, and it's up to us. We can do reprime again for 10 minutes, or we can do flush for 5 minutes, also by using a new saline bag. The flush will do flush for the blood compartment. For reprime, we will do reprime for all the lines, the blood compartment and the CRT bag lines also. So you can do both, flush or reprime, both are okay after the first prime. Okay? Means no need to prime, reprime, and prime test. No. One prime, after that flush or reprime. One time. How many bags you are using? 2 bags. 1 bag for prime, another bag for reprime or flush. 1 liter, 1 liter. Okay, agree? So approximately 1 minute remaining. Okay, it's a good question. Another question, please. Priming, reprime, okay. This flush option is new option. Flush for 5 minutes to flush. I have one comment here. After priming done, please don't go to review if your patient is not ready. What does it mean? It means I have to hold the freeze on number 6 until to assure you that your patient is ready. What if he's not ready? Okay, not ready for how long? 2 hours, 3 hours, 4 hours, okay? So after 4 hours, you can start the patient. How you can start? Bring 1 liter saline, put it, go to more option, do reprime for 10 minutes. After that, go to review and connect. If you go to direct to review, you cannot back to prime again. How long you can use the same circuit without reprime? 1 hour. 1 hour, 60 minutes. Now you did priming now. If you go to review, connect the patient, you have 1 hour to connect the patient. More than 1 hour, it's not good to use the stagnant saline for more than 1 hour. What is the answer? It's hold it on number 6 until 100% assure that you can connect the patient and go to review and connect the patient. Easy? Clear? So now we have 8 seconds on the prime, and I will choose this more option, flush and reprime. It will be very simple, very okay. So more options, change back, manual prime, accept. What is the manual prime? Keep your finger on it. Blood pump will run. Assure that you have enough saline and tap it. This is the manual prime. Okay, we have here. Oh, good. What is the more options? More options. How many options you have? Reprime and flush. What's the difference? Reprime, we reprime all the circuit with the lines with the blood compartment for 10 minutes. What is the flush? For the blood compartment for 5 minutes. Both you need to use 1 liter saline. Easy? Okay, no need to make it now, but you know it. So, I will accept, yes? In case, yeah, or by condition of patient is ready. If not, hold here in 6. Come after 4 hours, more option, reprime, do it and accept. Agree, guys? Please share this information with your colleagues. Very important. This one will save your treatments. You will be happy, satisfied, not doing anything, and you are shy, right? So now to accept our patients ready. Accept, review. What's the benefit for review? Review, you can change the flow. And you can check the filtration fraction. You know the filtration fraction? This is how much the blood is concentrated in the filter. It should be, what is the borderline? Percentage, how much? 25 with heparin and less than 20% with no heparin. Less than 25 with heparin prescription, less than 20% without heparin. So let's go to the change flow now. What have to change? Blood flow, make it what? 100, thank you. Okay. 100 now. Okay, what about the pre is the replacement pre. Post or replacement purple is the post replacement. Dialysate is dialysate. Easy, right? Any question about the flow rates? So, where is the confirm all? Confirm the temperature, 37, apply. So, where is the filtration fraction? In the review, last one. 21%. Good or bad? Good or bad, 21? What we are doing now? No anticoagulation, right? It means this 21 above 20, right? Little high. But remember, you put the blood flow only 100 to start. Once you put it 150, it will go down to 17%, 16%. So it means it's good. Good prescription, no problem. Okay? How to know? You will go again to change the flow, make the blood flow 150, confirm, and check it. It will be 17, 16. Easy? Accept. Finally, what we have here? Connect the patient. As usual, as your connection normal. Usually clamp the lines. How many lines you are clamping usually? 6 clamps. 6 clamps. Where clamp is the Y line, it will be here. The Y line here, it's 2 clamps. 1, 2. Axis line 3. No need to clamp the small line for this branched line, no need, because already clamped the axis line. Effluent line number 4, effluent bag number 5, return line number 6. 6 clamps you are clamping, okay? So after that, usually you have, this is our patient, the patient catheter, right? Patient catheter. Okay, assume this is your patient. So what you have to connect now? Red and blue, right? So we'll take the red and take the blue. So red and blue, you will connect it. Red with red, blue with, this is your patient. So what about the effluent line, yellow with the effluent bag, right? How many clamps you have to unclamp? 6 clamps. 2 in the machine side and 4 on the patient side, right? Access, return, patient catheter. You have to unclamp the 6 clamps and make it half clamp to mimics the same pressure of the patient. Okay, confirm all. Review connections, all good. Confirm all. Start the treatment. Congratulations, finally we got to connect our patient, right? So you will find 1, 2, 3, 4 buttons or 4 squares are black or like disabled or inactive. This one only for few seconds. The machine now testing the pressures and the flow rates. After that, in few seconds, you'll find it shining like this. It will be full prescription. Now, those pressures are gray color. In few seconds, also it will become with colorful, green, yellow, red. It will come with nice colors. It all happened in the first minute. Okay? So now we are getting the blood from the patient by blood flow 100. Okay, need like 2 minutes to take off the blood and back, return it to the patient with a proper temperature, which is 37. It's in the red one. This is the temperature, thermal. The good thing, no need to control it from this blood worm. All the control from the main screen. Here, nothing to do. No switch on or off, nothing. Everything through the main screen. Got it? So now assume that okay, 2 minutes passed. We are waiting for another 2-3 minutes, total 5 minutes. Okay. After that, we will adjust the blood flow. I'm waiting until this readings become colorful and axis a little bit high. I will decrease the axis a little bit and increase the return to mimic the normal treatment. Okay, return should be positive. So if 5 minutes pass now, what we will do? Go to the blood, increase it till to 150. Thank you. And confirm all. Okay, just override this one, confirm all. Now the blood flow is 150 now. Okay. So let's think quietly now. Okay, what reading or parameters you need to record from the machine for the CRRT? The pressures, right? Axis pressure, it's here. Returning pressure, second one. TMB, number 3. You see the colors now? And delta P is the pressure drop. It's called delta P, pressure drop. Here, filter pressure, effluent pressure, post-filter hematocrit, and patient fluid removal. This is the current patient fluid removal. It's here, PFR. Okay, so we can take a record now for the baselines. What we have now, TMB, axis, return, filter pressure, everything, pressure drop, everything. What else we need to take? After 2 hours, what you need to correct, to measure or to monitor? Also same parameters. And you need to check what it's the patient fluid removal after 2 hours, 4 hours. You will see the patient current patient fluid removal. So I need to see after 1 day, 24 hours. I need to see what is the patient fluid removal per hour and the total, right? From where we can bring history. Thank you. What is the history? Upstream here in the top. Sorry. What is the BFR? Third one, BFR. So you will find after 1 hour, after 8 hours, after 24 hours, and the total. It will come here also after 1 day, second day, third day. So you will find all the records on the history. What other things on the history? Okay, you came in the night shift and you will start your shift now. You need to see the history of the events, to see what alarm is coming or events happened for the patient, to just to know if this filter is working properly or not. If there is any issue with the axis or not, right? From the history, you will go to what? Events, number 4. Okay, so too many. I need to see only alarm events, right? I will go to the history events. I will go to alarm events. Okay. So the alarm is happening on the machine from start till now. Where you can see it. Okay, this return line clamp it, another one filter, high filter pressure, and so on. So you can have an idea what is happening in the last 24 hours. Nice, good to know. You will decide, okay, maybe this filter will not long for too much, I have to replace or not. There is some indication. So I need to know the pressure curve of TMB, for example. I will go to the history and pressures. You will find the graph here. Okay, I need to monitor only TMB. I can remove pressure drop, return, effluent, filter, remove it, exit. Keep only the TMB. I need to zoom in. Okay, so I will go. I can see the TMB. It can be coming up or spikes. You can see if there is partial clots, if there is clogging, any other reason. You can check it from the pressure history. You can check the temperature also, inlet temperature, outlet temperature, and the curve. But this one we can take it by more focus on the advanced training. But now just to have an idea what we have in the history. You have history for the prescription. You have history for the dose. You have history for patient fluid removal, events, pressures, and temperature. We're good? Close it. So we back to the main screen. So you are far here in the start of the room here, and you need to have a look on the prescription. You can see it from your side. You can see the numbers. Not all. What about the What about the blood flow? How much? 150. Pre-blood pump 500. This is a pre-replacement. Dialysate 1000. Post-replacement 450. Perfect. So you know now the prescription is HDF prescription because you are using dialysate, you are using pre-replacement, you are using post-replacement. Correct? Now we didn't put the patient fluid removal. How much you need as the patient fluid removal? 50 ml per hour, 100 ml per hour, more or less, right? Scroll it. Okay, I need it 100. You have to confirm all. So become 100 times. The machine start to remove excess fluid from the patient. How to monitor the patient fluid removal? By two ways. Direct from here and the history from history, PFR, patient fluid removal. You can check hour by hour. Easy? Okay, what else? I need to know when I have to change the bag, right? Timer for changing the bag. Where I can find it? First, you will see what is the color in each bag. What is the color percentage in each bag? Okay, the pre-blood pump or the white bag, you can find only you consume like 20%. What about the dialysate? Same, approximately. What about the replacement? Replacement is full, right? From the color, you can see it's full. What if I need exactly by minute to know how remaining, how much time remaining? Just press any place on the screen. Okay, here. 10 hour, 3 minutes for replacement. 3 hours, 32 for dialysate. 1 hour, 50 minutes for the effluent to change. 7 hours for the pre-blood pump. Easy? Now, all the timers are there on the bag. Okay, how I can change the bag? You have a change bag option, you have buttons. Here you see, change. Right? Okay, I need to change the green dialysate. Press on change. Okay, change bag or container. The machine will give you any other help? Okay, open it. Change, clamp, line, what's the new one? Okay. Simple, easy, any complications? Very simple, right? Another bag, what the other bag? Pre-blood pump, how to change? Press here, change. Do the things and cancel or close this. Very simple. Same thing for the effluent bag will be the same. For changing bag, done. For checking the patient fluid removal, the current one and the previous history, done. For reading the pressures, okay. What if I need to adjust the deaeration chamber here? How I can do it? Remember from the PRISMAFLEX, from where you can adjust. Okay, from tools, adjust the chamber, right? Go to the tools. Normalize BLD, adjust the aeration chamber, self-test, test the connectivity, take a screenshot, test the barcode, internal measurement. What you need here, adjust the aeration chamber. So I will up and down arrows. Okay, here it's a little bit up. I will press down and look. Okay, it's coming down here. Okay, tool coming down. And close this one. So you can adjust here, up and down, and close the window. From where? From tools. What if the sound is high and I'm night shift? I need sound to be low. From system. Thank you. System, go to sound. Okay. What about the brightness? Display. Okay. You close the light. Everything is quiet, just to lower the brightness. What in the day and full light, just to make it more bright and accept. Means system, sound and light or brightness from system. What about adjust the level here? Tools and adjust the aeration chamber. Thank you. So temperature, I need to decrease it. The patient is a little bit hyper now. 38. I need to decrease it. Make it 36.5. Accept. Apply. It will be takes 2 to 3 minutes. It will come down to 36.5 and so on. What's your idea? No option for green screen, but we have
lock option.
Thank you. Lock option. Please take your time. Take 2 minutes. Slowly. It's locked. So it's yours now, right? Finish. Happy? Satisfied? Yes. Press anywhere for 4 seconds like this. That will be immediately. Yes. Another question. What you need from the machine to do? Any information? Any idea? And after 10 minutes, we will start to stop the treatment, return the blood, and to see how to return it by a convenient way. Before this 10 minutes, what we need to see we need to see some troubleshootings, some alarms. Let's practice some alarms. Okay. Ready? So, one common famous alarm is
high pressure.
Axis extremely negative. You know this alarm? Many times happen. What is the main reason? Yeah. Okay, check. Moving, coughing, suctioning, blocked or clotted catheter, clamped or kinked line. Right? All thing mentioned. Okay. Machine takes approximately 20 seconds and give you acoustic alarm after it. Okay? And give you chance for 20 seconds to resolve it by a polite way. After that, shouting. Okay. Okay, let's mute alarm. What is it? It's a very important button, mute alarm, right? Yes. Small here in the right corner. Okay. So just think about it. Okay, axis extremely negative. Check the position of the patient, check the catheter, check the line, axis, the red line. Axis is a red line. Okay, you find some kinked, some suction, whatever the problem. And once the pressure coming down, okay, you will find continue button appear again. You have to press on it and it will work, okay? Once axis pressure resolved, you will find some bubbles here. Maybe you can do tapping on the filter, trying to adjust the drip chamber. Don't wait until level become very low and the air and blood coming to you, right? Okay, good. So what else? The opposite alarm is? What is the opposite alarm?
Positive.
The opposite alarm is return extremely positive, right? The problem now in the return line, in the blue line, right? So machine will give you return extremely, same thing, moving, coughing, suctioning, blocked or clotting, but from the return side, the blue side. Okay, and the machine will give you this, you see? This blue line is flashing, guys, it's a return, not the axis. Okay, if you didn't solve, the machine will give you high priority alarm system, yellow, become red. So, mute the alarm and think about it. Okay, we have too much pressure in the return. check catheter positioning, try to adjust it, and you see the return line if it's clamped mechanically. In the return alarm, you have to press open clamp. It's like release clamp on the PRISMAX. You have to press open clamp before continue to come. Continue not come before open clamp first. After that, continue will come now. You will wait. This is two common alarms that can happen, right? What's the third one? Any of the effluent bag, you change it in and you forgot the line clamped. There's a flow problem, right? But here, the machine will give you like so you see some bubbles coming here, suction. See this one? The nice thing the machine will give you flashing. Okay, which one? You see, easy now, right? Okay, guys, look at the scale. Which scale? The effluent one. Okay, we will go for the yellow line. What's the problem? Kinked here, there, where? Until to solve the issue. Okay, and you see here also? Very nice. Very nice, everything. I think automated now. Everything is mentioned. Okay, continue. And so everything is good. You can do it from. Actually, we need to have two plastic scissors. Why? Because when we are clamping the lines to remove the air, we have external bag here. So we need to clamp this line and to create negative pressure as usual, like the PRISMAFLEX. After that, to remove the clamps and to continue. This is the difference. If you remember air in blood with the PRISMAFLEX, what you have to do? You find one arrow, press the upper arrow until the return pressure become negative. Negative how much? Negative 30. After that, you release the clamp and you continue. Here's the extra thing here only to use clamps, but not this scissor to cut it. This plastic one or this, you need to clamp it without cutting it, okay? To clamp this post and to create negative pressure. After that, to remove one by one and release the clamp and to continue. This is the air in blood. Thank you. It's very important. Rarely it's happened, but if we adjust every time with the aeration chamber, we will not go to air in blood. Please be proactive and solve the issue in earlier stage. So, all good? Happy? Sure, some alarms will come with you during the session. Last thing to mention, what if the patient came to create and the body weight it changed after 2-3 days and you are in the same session? How to change the hematocrit of the patient and the body weight? If you go to the treatment mode here, from treatment mode, you will find patient. Okay, from treatment mode, you will find patient. Press patient, you will find two parameters, patient weight and patient hematocrit. You can adjust it, okay, and 72 for example, and accept and close. Means you can change the hematocrit of the patient and body weight anytime during the session by pressing this treatment mode and go to the patient and to change it. And also you can check the filtration fraction anytime from the treatment mode. You'll find it's the last one here, 16%. Okay, it's good, right? Lower than 20%. Perfect. So, stop the treatment. Now I need to change it from HDF to H. I will give you two updates. A good one, good news, and bad news. Okay? Which one will start? Good news. The good news is very simple. Now we need to change from HDF to HD. What you have to remove? The F, right? F is the hemofiltration, is the replacement. It means you will go to the pre-blood pump, make it 0. Okay. 0. What about the replacement post? 0. You have to compensate it on the dialysate. Means the dialysate now should be 2000, right? You have to compensate on the dialysate. So, and confirm all. Now, you will find replacement pre, replacement post, both are 0 and it's not active, inactive, right? This is a good thing that immediately you can make it. What is the bad news is still the modality here not changed to HED. In the new software upgrade, they will adjust this point. That once you change it here, it will come here HED only. So be patient with us until to adjust this one. But from your experience, you know that no replacement, it means it's purely hemodialysis, right? So how to add the syringe? You'll find here, close this one. Once you press like this, you'll find add syringe. Okay, you need to add syringe. Okay, we have one syringe now here, just to okay, just focus on this last point. Add syringe, okay. So, connect a new syringe to syringe line with green filter. Place syringe in holder with rings of syringe inside the clip as shown in the color and press arm up button. So, you will open this plunger clamp. You will take this heparin, connect here. Keep this line clamped. Don't unclamp now. Keep it clamped, okay? And press arm up. Okay, remember? Arm up. And lock this. Okay, what else after that? If needed, rotate only the syringe plunger to align with, okay, close plunger lock, okay, test the syringe button. Test the syringe button. Still the clamp is clamped of the heparin line. Press test the syringe. Okay. Now, unclamp it. You see the picture? Wait. And prime line. You have to prime the line now. After that, you will accept. Very easy, right? So, I need to put bolus now. Okay, put the bolus. How much? I need to put it 2 ml. Okay. Give bolus. Give bolus. What about the infusion continuous? Put the infusion. Whatever. And confirm all. Means now the infusion 3.4 ml per hour and you give heparin bolus also as well. Good? Easy? So let's go to stop treatment. We'll see how to return the blood. Ready? Stop treatment. How many options in stop treatment? End the treatment, change set, recirculate blood, recirculate saline, or resume treatment, go back to the treatment again. Anytime you can stop, you can resume the treatment again. Okay, so end the treatment, we will do it now. Change the set, if you will change the circuit for same patient, right? You will return the blood normally and the machine will save the patient parameters and prescription and will ask you to attach the circuit and to do priming. Easy? What about, you know, we have two types of recirculation. Blood recirculation, keep the blood, and saline recirculation, you will return the blood to the patient and you do saline recirculation. This is as usual, no difference. So we'll do end the treatment. For end the treatment, there is 3 nice options you have to confirm it to the machine. First one, it's same patient, new patient, or discard all. You have same patient, you will do another session for same patient, or new patient, you need to do another session for new patient, or discard all. It means you finish the treatment, you will not do any session now. This is a 3 option. After that, return the blood, yes or no. If the blood is good, not clotted, you will press yes. But before that, you have to select which patient. New patient, same patient, or discard all. If same patient and return the blood, yes, you can reuse the fluids. Yes. It means no need to discard or throw all the bags and use a new one. This is the same patient, same machine. It means you can use the same bags. Okay? It's cost effective. But if you choose new patient or discard all, no way to reuse the bag. It's not allowed, right? So we choose discard all. We cannot use, okay, blood flow stop because we stop the blood pump for longer time just to continue. And return the blood, yes, we need to return the blood and accept. So, usually how to return the blood? Clamp the access line from the patient, right? And connect it with the saline bag, keep the return line open or unclamped on the patient side, normally, right? We will do this one, unclamp, and next. So this is what I told you. The machine, remember that you have a total blood volume is 179. If you need to minimize it, okay, maybe this patient is over fluid or excess fluid, no need to return back blood with 179. Maybe you can select 1/4 only for this patient. Another patient, you need to give him more saline. It's case by case, right? What about the return rate? Return rate is how fast the blood pump will run. From 10 till 100. Maximum is 100, minimum is 10. Usually 70-80 is the average. We're using 70-80 ml per minute as average to avoid any hypertension or any excess fluid to the patient. Just make it 80, maximum is 100 ml per minute as a blood speed. All good? You have two options. Manual return the blood. What is manual return? Keep your finger and wait. What is return the blood? Auto return. Press return the blood and wait. So on the machine now, returning the blood to the patient from the saline bag in the access to the return line to the patient, right? Anytime you satisfy that you need to stop, press stop return. Anytime. You need to add to return the blood again to resume it. So, you find you observe some clots here on the delivery chamber and you don't want to return more. Khalas, you will press disconnect. Once you press disconnect, the machine will tell you, okay, but less than 100% of the blood return it to the patient. Are you sure? If you confirm yes, okay. If no, you will back to return the blood again. It means yes. So, now what you have to do, you have to disconnect your patient, you have to clamp the access return line and remove it from the patient and from the saline bag, right? It means you will clamp, both should be clamped, and return line also should be clamped. And disconnect, keep this access is away from the patient. Your patient is free now, right? Okay, confirm all and accept. So unload set. Before unload set, what you have to do, you have to clamp all the lines and disconnect the bags. This is extra step now, okay? We will clamp and disconnect. To be easy to remove the cassette after that, right? And disconnect. Third one, remove, disconnect from the line. So, okay, now you can unload the set. Press unload and wait. Okay. Unlock and remove Syringe disposable without disconnecting lines to the set. It means now you will unlock and remove the set, but don't remove it from the circuit. Only remove it from the Syringe warmer. Okay? Now I'm not removing. Sometimes it's coming easy with you. Sometimes it's stuck inside because maybe now 2-3 days and it's stuck inside. If it's stuck inside, how I can do? There is 2 locks on the right and left side. Black one. You will open 1, 2, lift it up, and remove. Close it, and keep it unlocked. Okay? You have 2 options. First option, unlock and remove. If it's stuck, open both sides and remove it. Also, you can do the same practice if you need to clean or wipe it inside. You need to clean this stainless steel one by wipes. You can clean it and close, and that's it. But remember to close it to secure it. So don't disconnect this one because blood will come in. Keep it closed with the circuit. So accept. Now we have to remove and discard the bags. We'll take all the bags and discard it. You can see now your bags are free. Now your bags are free now, right? Just remove it, but please don't discard this. Okay? because if one scale is missed, you cannot use the machine, right? That's very important. What you know in some hospital do, one big hospital in Abu Dhabi, they are collecting all the carrying bars. Once you finish the treatment, they are collecting it, put it in a bag. Anyone who need to use the machine will go and borrow 4 scales to the machine. Use. Once you finish, he has to return back the 4 box to the bag. Like systems, they have a protocol. Not keeping the scales here in the machine. Once finished, you are collecting the 4 and put it in bag for the scales. They have 17 machines here. Maybe like here, 15. Collecting multiply 4 multiply 17, put it in a big bag. Any nurse will go there, collect 4 and use, and she is responsible to back the 4 scales to its location. They are doing by this way to avoid this problem. Okay, so we remove all the back. All are clean out. So the number 4 here is the fluent bag. I have to clamp it here and there, and also when we can clamp the slide, I can do it by this way or the move. Okay, disconnect. So I will remove everything by the same way. Okay, easy. Set it here, put it here.